As women go through those first few foggy, very sleep-deprived weeks of motherhood, they face so many new challenges. And for many moms, breastfeeding tops that list. It can be so overwhelming. How do you make sure you're giving what your baby needs?
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the informed side of care. Welcome to Baptist Health Talk.
Welcome to a new episode of the Baptist Health Talk, where we answer your most searched questions on the internet. Today's topic, breastfeeding. I'm Neki Mohan, your host for today. This is where lactation specialists come in. They can help mamas out there grasp the technique and navigate through the challenges from sore nipples to low milk supply, mastitis, and more. Consider this a starting guide to breastfeeding. And we have our very own Baptist Health lactation specialist, Carey Acosta, to talk to us about breastfeeding. So happy you're here.
Thank you. I'm glad to be here. Thanks so much.
We're going to dive right in.
Let's go.
For many mothers, deciding to breastfeed involves a lot of factors. Let's talk about, we hear this all the time, what are the benefits of breastfeeding?
Benefits. Okay.
For mom and baby, right?
Yeah, for mom and baby. So for baby, there's a ton of great benefits. It helps lower their risk of diabetes. It can keep them healthier. They get antibodies, so they get sick less often. They don't get ear infections as much as a regular bottle-fed baby. For mom, it lowers her risk of heart disease, uterine and ovarian cancer.
Wow.
It can actually lower her risk of postpartum depression, which is huge. And
I figure the bonding would probably help with that.
Yeah, the bonding. And then the best thing is that they get back to their pre-pregnancy body weight much quicker, which I think a lot of moms really appreciate.
We will appreciate that.
Yeah,
no doubt.
For
sure. What can an expectant mother do before the baby's here to prepare for breastfeeding?
I mean, I think really the most important thing, first, talk to your family. Let them know what your breastfeeding wishes are, because that's really important, because you're going to need that support. Take a class. Knowledge is power. One thing I would say, avoid social media. I know it sounds kind of crazy, but it's true, because, just because somebody's on TikTok and saying, hey, you should do this, it doesn't make them an expert.
Right.
Also getting a breast pump ahead of time, because you might run into the event that you have a preterm baby, and really insurance companies cover them now. So just trying to get that pump, ahead of time.
And
helps.
everyone's different.
Yeah.
It's so important to know. Some mothers choose to breastfeed for a few days. Some choose to just breastfeed for a few months, some a few years. What's the suggested time frame a mother should breastfeed, and should anybody regulate that?
Well, I mean, if you go by what the standards for American Academy of Pediatrics and World Health Organization, they say 6-month exclusive. Then you introduce solid foods. And then really they want you to breastfeed continuing for 2 years. However, right. And we say 2 years, but you have to take into account what works for each family. Some people might not have that ability. They have to go back to work. So ideally, at least for that first 6 months, if you can, exclusively breastfeed, give the baby food, and then, at a year, transition into cow's milk.
Yeah, I couldn't breastfeed because I was sick and I was in the hospital.
Oh, wow.
It's just so there are a lot of factors that go into being able to breastfeed.
Yeah, no, it's true. And a lot of times when moms can't, like in your case, maybe you really wanted to and then you couldn't, that alone can lead to postpartum depression. So,
somehow she survived.
Yeah, because they will. Because you fed your baby.
Yes. How can I tell if the baby's getting enough milk? If you're a mom that is breastfeeding,
right?
How much milk should the baby be getting at different stages? Is it simply, okay, they're gaining weight, so they're getting enough milk?
Well, I mean, that's important. When you take your baby to your well checkup, they should be meeting those milestones. That's definitely important. But when you're breastfeeding, you should hear swallowing. Your baby shouldn't be crying all the time. You can look at voids and stools, making sure your baby is pooping and peeing enough. As far as how much during different stages, it's kind of hard to say, because if you have a preterm baby, they might have higher caloric needs. It depends if you have a really large baby, that one might need a little bit more. Right. So, there's a lot of factors that play into that. So at that point, I would say just reach out to your pediatrician. But if you're exclusively breastfeeding and you're truly breastfeeding on demand when that baby wants, you should be doing okay.
Babies are like a science experiment. I remember writing down what went in and what came out every day.
Oh my God, yes. But it's so true. It's so true. And I think that we get so fixated on that, and I tell moms, try not to worry so much about that too.
I drove my pediatrician crazy.
Yeah, me too.
Will breastfeeding impact my baby's sleep? And of course, mommy wants to know, how is it going to affect my sleep? Some babies feed every 2 hours.
Yeah. So that's a great question. So yes, it can it can have a positive influence because babies who are breastfed are going to be less colicky, less fussy. However, yes, breastfed babies, they might do what's called cluster feeding, where they're going to be at the all-you-can-eat buffet, literally. So you're like, I just fed you 20 minutes ago. Why are you feeding again? And they're going to continue to do that for hours, and you're going to be exhausted as well. But then that baby's going to then sleep a little bit longer after that, where a bottle-fed baby, they'll feed, sleep 4 hours, feed, sleep 4 hours. So both babies that are, either breastfed or bottle fed, they're going to get the same amount of sleep, but it might just come in different intervals. Believe it or not, though, there's studies that show that moms who exclusively breastfeed actually get more sleep than bottle fed babies.
Really?
Believe it or not. Yeah.
That is surprising, but
Yeah.
good to hear.
Yeah.
Another plug for breastfeeding
I know.
there. A lot of moms want to know, can they take medication while they're breastfeeding?
You
know they control medication while you're pregnant.
Yeah.
And what about some people, they want to have caffeine or alcohol, and then they do the whole pump and dump. We see it in movies.
Yeah. So absolutely.
What's the science?
So science. So medication, 100% safe. You can take, whatever your doctor prescribes, absolutely. But antibiotics, I would say 99.9% of them are safe. Even more in the hospital, we give our moms after C-sections. Some of them get Percocet, and we'll be taking the baby to breastfeed. Now, I'm not going to be giving them Percocet around the clock and notching the baby like that. But yeah, you can have pain medicine if needed after your surgery and still breastfeed. Most medication is safe. But again, always talk to your doctor regarding, just to make sure. Caffeine, absolutely. If I could not have had caffeine after delivering, I might not have breastfed because I worked night shift. There was no way. Obviously you don't have like a giant cafecito or something, like 5 of them, but 1 or 2 cups of coffee, that's fine. 1 little shot of coffee. Yes. Alcohol. You can actually have a glass of wine, 1 beer, 1 margarita, not 6 of them, and continue to breastfeed. But if you're going to go out and you want to go out and have fun one night, there's nothing wrong with that. Yes, pump and dump. But why pump and dump? A lot of people think you're going to pump and dump and get the alcohol out of your breast. It's more just so that you don't wake up like rock hard in the morning and engorged.
Oh, so it's more for your benefit than it is for the milk's benefit.
Yes, it doesn't remove that alcohol from your breast. It's just you need to be emptying your breast so you don't get engorged.
Wow. And speaking about that, mastitis. Mastitis is a painful infection that many women can get while breastfeeding. What do breastfeeding mothers do to avoid getting mastitis? And when do you go to the doctor?
So some of the things you can do, 1, breastfeed on demand, which means emptying your breast at least 8 to 12 times in 24 hours. That's really important. Or if you're pumping, making sure that you're pumping often enough as well. Making sure the baby's latching well. If you have pain and where it's excruciating and it's lasting throughout the entire feed, definitely at that point seek help because you're going to get cracked nipples, and then that's how bacteria gets in there. The other thing, when you're pumping, you have the part that goes on your breast, the flange. So that part, if it's too big or too small, so if it's too small, your nipple's going to rub inside.
And that's where you come in for the fit.
Exactly. So that can also lead to mastitis. Now, how do you know? When is it time to go to your doctor? If you're touching your breast and you feel like a hard area and it's red, if it's streaking, if you're feeling like you're coming down with the flu, I say go, because it's not going to hurt to get checked. But if you don't, long term, if you leave it untreated, you can end up with an abscess, and then you're looking at a surgical intervention. Wow. So you don't want that. So either, call your doctor, or if not, go to urgent care.
Yeah, I tell people, once you have a baby, your body's no longer yours.
Oh, no, it's true.
It's no longer 100%, yours.
Yeah.
Now, if you're one of these blessed people and you're having a lot of breast milk, how long and you're freezing it, how long does frozen breast milk last? And what's the golden rule dubbed for that liquid gold? Because it is, I know people that could donate, they were making so much milk.
Yes.
And they were little people. Yeah. Like people think, the size of your boobs, you can give them milk. It has nothing to do with it.
No, it makes no difference. And then there's women now that will literally sit home and pump and sell their breast milk. There's a market for it. But if you're just, storing it for your baby, 6 months in the freezer. If you have a deep freezer, you can do 1 year. Now, the way that I always explain it to my patients, just remember 6 months in the freezer, 6 hours at room temperature, and 6 days in the refrigerator. And then if you have that deep freezer, you can leave it for 1 year.
Wow.
So it actually lasts a long time.
Yeah, I have a friend that she donated for
which
a
is
NICU
amazing.
somewhere.
Yes.
And what a gift.
Yeah.
What a gift.
There's a lot of milk banks now, all over the country that accept that milk also, where they pasteurize it and they give it to those babies in the NICU, which it's so needed.
Body's an amazing
thing.
It is.
It is.
Is it okay to supplement breastfeeding with formula? I had a 10-pound baby. Wow. she needed food.
Yeah,
she
she
came
was-
out of the womb hungry with low
Hangry.
blood sugar.
Hangry.
Yes. Demanding food.
So absolutely, especially when you have a baby that's on blood sugar protocol, we want to supplement. In your case, when you were hospitalized, like
Yeah.
you just shared with us,
Couldn't do it.
that baby's going to have to get formula. If you're trying to exclusively breastfeed, I would always say try and breastfeed. But if that baby does need to get supplemented, there's nothing wrong with that. Now, talking about supply, the first 3 days, women think that they're going to have this huge amount of breast milk. We don't. We have colostrum, which is exactly what that baby needs. Their tummies are like tiny, tiny, tiny. Your second milk comes in at about day 3. Once your second milk comes in, it usually gets a little bit easier. And if you wanted to do breast and bottle, that's okay too. But just keep in mind, what are your long-term breastfeeding goals? Because if you're not stimulating your breast frequently and you're, doing more bottle than breast, then you're not going to get that abundant milk supply like you would want.
But how about if you're pumping overnight so somebody else can feed the baby while you sleep?
As long as you're waking up and pumping and you're still stimulating your breast, absolutely. There's nothing wrong with that.
Can't you put it on automatic while you're sleeping? It just
That would be
comes on?
great.
They haven't invented that yet?
Well,
we got an idea.
There is hands-free pumping now. So you know what? I wonder.
I had a girlfriend that used
Set
to
an
drive and
alarm.
pump. It was very bizarre.
I've
She got pulled over too. Yeah, it is a
Oh
whole
my
other story.
God, I would die.
We digress. What are
would
some
die.
of the common challenges with successful breastfeeding that you see? And what are some helpful tips to help increase the supply? We see these people selling teas, what is.
So challenges, I think the lack of knowledge, not having a good support system. I think if you don't surround yourself with people who are going to be supportive, it's going to be really hard to be successful, because maybe you're, that mom or mother-in-law didn't breastfeed. So then they're going to be like, oh, what's wrong with giving a bottle? And if your goal is to exclusively breastfeed, that can really play a part in it. And as far as, supporting moms, helping the mom when she's tired, stuff like that, making sure the mom is eating, those things are going to help too. So
I think new dads have a different appreciation. Not too long ago, dads didn't even go in the delivery room.
No,
and
it's
I have a
true.
new dad at work that he is so involved. He knows so much. He knows way more than I do.
No, it's true.
And that's so great because we have to empower them to feel part of the process.
Also, knowing like where to get your resources, I think is important too.
Yeah,
I
that's why they
think
have
that
experts
does-
like you on our podcast.
Thank you.
Yeah. Here's a question that often comes up. I'm going back to work soon. When should I start pumping?
Yes, that's a great question. So ideally, we would want to wait 6 weeks. However, many women don't have that luxury. Like they have to go back to work by the 6 weeks. And the whole reason they say 6 weeks is you want your milk supply to be well established. And how does it get well established? By that baby breastfeeding. So your body kind of knows how much milk you need based on how much that baby feeds. So if you're going back to work at 6 weeks, we would say maybe about 2 weeks prior, start pumping. Do like a late evening feed and then an early morning feeding. You can start pumping and then whatever milk you get, you just put it in the refrigerator and then start, saving it up. And then, once you have about 2 ounces, 3 ounces, then you can move that to the freezer.
Yeah, and you hear so much that breastfeeding helps you lose weight.
It sure
But
does.
How many calories do you really need to consume to support breastfeeding? See, I would hear that and be like, buffet time, here I come.
Well, believe it or not, I know it's true. You actually need an extra 500 calories. From your normal caloric intake. You need an additional 500 calories. So you're thinking, oh, forget it. How am I going to lose weight like that? Believe it or not, you do.
Yeah.
Because that little baby takes everything.
Yeah.
And when I say an extra 500 calories, it doesn't mean go get a Big Mac. Obviously, if you want one for that day, have it. But, try and make sensible choices, a healthy snack, a peanut butter and jelly sandwich, stuff like that. But yeah, if you just do that and make sure you're
And
staying
just have
hydrated.
food ready because you probably feel more hungry as well.
Yes. And you do. That's the thing is I was like ravenous. Like especially because during my pregnancy, I threw up almost my entire pregnancy. So when I delivered and I can eat, I was like, oh, thank you, Lord. And then I'm breastfeeding and I'm like starving, but the weight's coming off. I'm like, this is the best diet I've ever been on in my life, but
Yeah.
But then I stopped breastfeeding.
Yeah, when do you find time to eat with those kids? I mean, they take a lot out of you.
No,
But
it's
you got to
true.
eat. Partners and loved ones can, again, feel helpless at home when mom is breastfeeding the baby. Give us tips on how they can help support her and set her up for success.
Well, one, just what we were talking about, have food set up for her.
Yeah.
Bring her food. Make sure, she's sitting there feeding, especially if you have twins. Like, you're not going to be able to feed yourself. I've had dads literally feed the moms to help them because, they can't. Giving her grace.
Yeah.
Because, it's such a hard time for that mom adjusting with the hormones. It's overwhelming. She's going to be like on a little emotional roller coaster, trying to make sure mom gets out and just takes time for herself. I think those are really ways to support her. Changing the diaper, picking up the house, just things like that. Just giving her that
You're
support.
saving marriages as we speak.
Oh, I hope so.
Can you explain your role? What's the role of a lactation consultant, and how do you help new mothers on their breastfeeding journey?
So the role of a lactation consultant is, to provide support, provide education, help moms and families along on their breastfeeding journey. The way that I help moms a lot, I share my own breastfeeding experience. I had a hard time, and that's actually what prompted me to become a lactation consultant. I had a really difficult time the first couple of months with my son, and I found myself, searching for information, misinformation, and I became passionate about it. I also offer free follow-up lactation at my hospital. So if someone delivered there and they need help breastfeeding, they can come back to us for free, which is something that helps. And then honestly,
And you're covered by insurance.
they don't even have to, yeah.
Wow.
It's just through the hospital.
Oh, wow. It's a service.
It's a service. Yeah. It's something that
hospital.
we offer. Yeah.
What gives you the greatest joy in your job?
Seeing moms, that smile, that bond that you see when a mom breastfeeds, or when she's really, when you have a mom that's been struggling, and she's been trying so hard, and the first time I get the baby to latch, just being around the moms and babies, it's such a gift. Like, it truly is. Like, I say it every day that I have the best job in the world. And I do mean that. Like, I really am
Babies
blessed.
are miracles.
No, they really are.
They're miracles.
Like, how do you ever go to work and have a bad day when you're around that every day?
I would be smelling everybody's baby, but I'm
I
sure
do.
that's
We
like
do.
the-
No, we smell the babies. We do.
Yes.
We'll be bathing them and smelling them.
Yes,
I know it's
the best
great.
smell in the world.
No, it
Well, thank
is.
you so much, and thank you for all that you do.
My
These tips are
pleasure.
going to help so many people.
Thank you. I appreciate it.
This has been a great conversation. Thank you again for sharing your insight with this audience. Remember, viewers, you hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from all of our experts. Thank you so much for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.